You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome back to another episode of the ATS Breathe Easy podcast. I am your host, Dr. Ugo Ezema. I have the honor and the pleasure of having Dr. Katherine Hisert and Dr. Josh Fessel. They'll moderate our first two keynotes at ATS 2026. The Sunday keynote is Vaccines, Past, Present, and Future, with keynote speaker Dr. Demetre Daskalakis. And Monday's keynote topic is the Supreme Court, the Administrative State, and You, with keynote speaker Mr. Stephen Vladeck. Dr. Hisert and Dr. Fessel, welcome to the show.
Thank you.
Thanks very much. It's good to be here.
It's really good. I appreciate y'all taking the time out on this beautiful morning. If you guys don't mind, please give us a little background for the both of you. We could start with Dr. Hisert.
So I'm Dr. Katherine Hisert. I'm an associate professor of medicine at National Jewish Health in Denver, Colorado. Work in the pulmonary division, largely focused on bronchiectasis clinically. Started with cystic fibrosis and is now branched out to non-CF bronchiectasis. And I have a lab that studies chronic infection and inflammation in bronchiectasis.
Yeah, hi, I'm Josh Fessel. I'm trained as a pulmonary critical care physician and a pharmacologist, and I've worked all across the spectrum of clinical care and research activities. Started my life in an academic medical center, running a basic and early translational science lab, and then seeing patients, as I say to people, living the 90-40 dream, 90% research, 40% clinical care, and then moved to the National Institutes of Health in late 2018 and was a medical officer at the National Heart, Lung, and Blood Institute, was still at NHLBI when the pandemic started, and so got very involved with lots of pandemic response efforts led by the NIH and contributed to by the NIH. Moved to the National Centers for Advancing Translational Sciences, or NCATS, in the midst of that. And the role that I held and left from NIH about a year ago was the chief medical officer at NCATS. And so I've worked with partners in government, in academia, in nonprofit spaces, in the private sector. And I've had the great pleasure of working with the American Thoracic Society for many, many years. So it's wonderful to keep the fun and the good work rolling.
Wonderful. Thank you so much for those succinct and thorough at the same time intros. I'm always curious about what it means to be, one, a keynote speaker, and two, the moderator for the keynote speakers. Those are two very important roles. One, let's start and talk about what ATS, the conference, means to each of you, to both of you, and why the topics at hand for these keynotes. So for Dr. Hisert, vaccines, past, present, and future, and for Dr. Fessel, the Supreme Court, the administrative state, and what that means for us as providers. What does that mean to y'all? Let's start with Dr. Hisert as well, again, and what does ATS mean to you, and this opportunity to moderate this particular part?
Oh, well, I'm really delighted to have this opportunity and was honored to be asked. I have participated in ATS, probably not as enthusiastically as Josh over the years. As someone in cystic fibrosis, I've been for a while was largely in that community, and now it's been an amazing opportunity to kind of blossom out into broader lung diseases. And so in the last few years, being at ATS has been just an extraordinary opportunity to connect with the community and people from all over the country and all over the world, and build relationships and collaborations and discuss, those cutting edge ideas and some of the, more outlandish ideas that some people are trying to push forward, which may be true. And so it's just a great community and an opportunity. It's huge, and you have to know how to navigate it. But I actually find that the size now gives me the opportunity to really connect with a broad swath of people. And so to be able to participate in this way, to help open the conference by moderating this keynote is really an amazing opportunity. And the topic is so relevant right now in terms of, we will all think about respiratory vaccines in particular, but I think that, understanding, starting with the COVID pandemic and then moving into how the Centers for Disease Control have been changing guidelines. It's really important to understand vaccines right now as a scientist and as a physician in terms of how they're developed and how they're tested and what the data are and why recommendations are made. And I think that it's a really great topic. And our keynote speaker has come from multiple different areas to be able to speak to all of these topics. And I think that it will be very accessible and interesting to the diverse populations that come to ATS, whether you're a nurse, a doctor, a scientist, a pharmacist. I think that this will be a really interesting keynote.
Absolutely. And today is such an important time. I'm using today as a reference of the era of time that we're in, where the trust in the medical establishment is at an all-time low.
Mm-hmm.
And by extension, vaccines have now become something of a pop culture conversation.
Yep.
In a way that they've been diminished in terms of how tremendous the influence and how much progress vaccines have done to the human lifespan and to the human condition, if you will, over the last 100 years. So I am looking forward to that. Absolutely. And Dr. Fessel.
Yeah, I mean, I could yes and so many of those points that you just made, Katie. The ATS has been my sort of professional society home for a really long time, and I'm still discovering new partnerships every year that I go to the conference, and I think that's one of the real superpowers of the ATS is to continue to bring people together in an ever-growing but still cohesive community, and I think that feature and that message and that superpower is very much of the moment. And I think you'll hear some of it reflected in Stephen Vladeck's keynote address. He's going to talk about the Supreme Court, the administrative state, and you, which as a former bureaucrat, a bureaucrat at heart, I absolutely love this because I never imagined that policy and law and administrative process could be interesting stuff. And it absolutely is when you get into it. And we're living in a moment where you got to get interested. And those big diverse communities become important because it used to be that we could just kind of keep our head down and do our thing and stay focused. And that was a recipe for success and progress. But we have to pay attention to so many other factors now to keep the biomedical research and public health enterprise and the respiratory health enterprise healthy and vibrant. And so Stephen is going to talk about what has come into the discussions and come into our thinking from the standpoint of law and administrative process. And it sounds like, in unskilled hands, I think this would be a potentially dull as dishwater kind of topic. Mm-hmm. Stephen's going to knock it out of the park. I already know that. He's a best-selling author. He's CNN's Supreme Court analyst. He is a superstar at taking this stuff, distilling it, and making it interesting, real, and relevant. And so I couldn't be more excited to hear what he has to say. I've gotten a little bit of a preview, and I'm not going to give everything away here. But this is, I think both of these keynotes are going to be ones that are going to have immediate resonance and really feel relevant. And they're going to be, I think, the kinds of keynotes that in years past you might not have expected to hear at the American Thoracic Society conference. They're exactly the kinds of things we need to hear this year in Orlando.
Yeah, both of these keynotes actually go hand in hand, right? The administrative state and what that means for the general public helps to inform how people feel about vaccines. And by that, I mean vaccines have become such a political touch point.
Well, I'll add to this that
yes.
So the keynote that I'm moderating is Dr. Demetre Daskalakis, and speaking to that, he has the background in so many areas. He's worked within the New York Department of Health. He was the commissioner in charge of the COVID outbreak, then went to the CDC and was in charge of respiratory vaccines at the CDC before he quit that position. And now he's the chief medical officer at Callen Lorde in New York City. And so he brings the city pandemic outbreak perspective, the city health and hygiene perspective, the national CDC, how decisions are made about vaccines, but he knows the science. He's completely based in the science. And then he also brings this background of having, been so entrenched in the LGBTQ community and the HIV community of activism. And so the next step forward is, how do we as a community come together to make sure that the messages are getting out there? So, it is like so many different aspects of these topics. You have the science, the medicine, the politics, the policy, and activism together. I think that, as you said, these two keynote speakers both bring all of this. And I think it'll be really timely and also very engaging for the audience.
Yeah, they're both the real deal. I'm really excited.
I am too. I think one of the things that's actually standing out to me about all of this is because healthcare has become so politicized, and personal health, community health, public health has become so politicized. We as providers are almost now, it's almost an obligation to be informed in a much more detailed way about what's happening around the policies that are shaping public health. And of course, that translates to how vaccines are being developed and how the policies shaping those are being developed. And we have to now understand the politics and how not to keep saying it, but how the administrative state contributes to that.
And it's so important to think about how, as clinicians, we message to our patients. Things used to be a given. You'd come in and say, here's your vaccine. And now we have to be savvy to the fact that we might get pushback. And so does that mean, knowing the science better? Does that mean understanding the resistance better? What is the hesitation? And I think, thinking about these things in a way that we can help the community. Individuals need to be protected with vaccines so that the greater community can be protected.
Yeah, that's absolutely right. And I think that theme of increased awareness from lots of different directions is going to resonate throughout both of these keynotes, and then probably a lot of the other discussions that we hear at ATS. You're exactly right, Katie, that the conversations with our patients have changed. The conversations that investigators are having with funding agencies have changed and are still changing. It's a hyper-dynamic environment. And, all of the different influences that come into that. Ugo, you mentioned, social media and TikTok and, and all of that. And that's you can't ignore that. You'll hear from Steve about the legal aspect of that, how, a decision made by a federal court in, pick your state, you got 50 choices. Any of them could be the one making a decision that has ripple effects across the entire country, across the entire enterprise of how we take care of our patients, what we can offer and when, how we access the resources to do the research that drives diagnostics and treatments forward. And so that awareness is super important for all of the different conversations that ATS members are having with all of the different folks they interact with. Complicated.
Very, very complicated. Dr. Hisert, how do you know Dr. Daskalakis?
Oh, I'm meeting him now through this opportunity, but I will say that it was a name that I have many infectious disease colleagues. And when I said, hey, I have this opportunity, he is a rock star. Like, the number of my colleagues who were just like, he's the best. I'm so excited for you. Especially within the HIV research community and advocacy community, he's done so much. And I think he's been involved, obviously, in respiratory. But I think, this is a great opportunity for the ATS community to get to know him better, because I think he's a little bit, he's on the periphery of the ATS. There's an overlap there. And he was even saying he's so excited to be invited to what is not his professional organization to give a talk. It's like such an honor to have that happen. And it does seem like wonderful cross-pollination to get this expertise that has been so important to the infectious diseases community to become part of our community as well.
He's also a known rock star in federal science circles.
I'm excited to introduce a new benefit. ATS Now is a multimedia platform that's AI-driven and allows you to search ATS content for what you need to learn about and know more, whether it's ATS conference material or webinars, etc. It's really tailored to your needs and when you need them. It's like Netflix for pulmonologists.
It's a really cool researching both of these speakers. You mentioned that you're a bureaucrat at heart. That is a bold thing to be saying in 2026, where there's a lot of anti-bureaucracy. I feel, at least from my anecdotal experience. Can you tell me what that means to you and why you feel it's actually important to have people that are passionate about making sure that we have systems in place that help push society forward and make these changes and policies that benefits everyone? What does being a bureaucrat mean to you, and why do you feel it's important?
Bless you, Ugo, for asking that question. My heart is singing. So it was a surprise to me to learn this about myself, right? Because I'm not actually a lover of process and rules and that kind of thing. But it was the lived experience of being at the National Institutes of Health and seeing that policy and process done right is transformative and catalytic in terms of getting done what you're trying to get done efficiently, effectively, safely, equitably. We can still say that word. It all matters. And I think I was drawn to it because I do love puzzles. I've always loved puzzles. That's what drew me to science. That's what drew me to medicine. Puzzle solving in the policy and process world is very different from any other kind of puzzle solving I had ever done. You have to have data. You have to have an understanding of system dynamics, how people work together. So there's human psychology that gets woven into that. And you have to be able to project into the future a little bit and say, okay, what we mean is this, but what might happen is this other thing. And you have to, if you're doing it right, you have to take that into account. It's a painstaking process. And then you always have to remember that the best built processes are ones that have ways to change themselves, because you're never going to get it right the first time. And it's not going to fit every situation across time. And so if that sounds like a thing that takes a whole lot of thought and care and input from lots of different people, well, again, yes, if you're doing it right, I think that is what it takes. And I also think that's the right way to practice medicine. And I think that's the right way to do science. And I think that, so there's resonance there. And that's why I've really been drawn to it. And in the current moment, you're exactly right. There's been a lot of sort of anti-bureaucracy sentiment percolating through discussions of all sorts. And I think sometimes it comes from a place of, I always want to ask people, well, have you actually talked to a bureaucrat? Like, do you know what you're talking about? Because, I told people early on when things really started turning over within the federal government, if you had asked any full-time Fed, hey, is everything perfect? Or would you change anything? I think most would have said, would you like a bulleted list? Or would you like the narrative form? Or do you want an interpretive dance? Like, I have thought about all of the things that need to be done better, and I can give it to you any way you want, but there's a way to do it. And we've seen some examples of what happens when there isn't a process brought to bear. And frankly, it creates a lot of instability, which is, again, a theme that you're going to hear Steve talk about in his keynote, that when you get rid of process, when you get rid of the structures that let you do the things you're trying to do, instability is often the result. And that's usually bad for creativity. That's usually bad for progress. That's usually bad for deliberation and care of the kind that you want to bring to every patient interaction. Mm-hmm. So we could do a whole other episode about why I love being a bureaucrat, but we'll leave it at that. Thank you so much for asking that.
Well, I mean, honestly, I think the biggest thing that I'm getting from the both of you, and if I could distill it down to one word, is passion. I can feel the passion through the screen coming from both of you. Dr. Hisert, you work with a very, I think, largely underserved and often misunderstood population. This is the 65 group.
Mm.
And their care has to be one that's very holistic. I trained at Tulane where we have a cystic fibrosis clinic.
Yep.
And so, yeah, thank you. Thank you. I'm saying thank you as if I'm running the clinic, but I'm honored to be associated with Dr. Kingsberg and Dr. Bojanowski there at Tulane.
Yeah.
So with regards to vaccines, I'm sure that this is an important conversation that comes up for that patient population. As clinicians, tying both bureaucracy with our patients' needs. As clinicians, we've always been pointed towards the CDC as the gold standard. And I've read Dr. Daskalakis, and I hope I'm saying that the name correctly. He's an infectious disease physician, as he pointed out. He's hinted at a lack of trust about what's coming out from the agency. I wonder, how can we as providers, the physicians, the pulmonologists, the infectious disease experts, the nurses, the respiratory therapists, anyone that's listening right now, how do we navigate? And what do you think about where do we go for reliable vaccine guidance? And knowing that this is how bureaucracy impacts real people's health. What do you make of that?
That's a great question. And that's actually one of the topics that I want to discuss with Dr. Daskalakis in this keynote is, whether you're a physician who's just, it's so hard to keep up on the recommendations, you're a family member, you're a nurse, whoever you are, you're a patient, where do you get the best information? Let's say, even if you trust everything that's coming out of the CDC and you just want to kind of hear what the experts have to say. So there are new forming communities and associations and guidelines coming out independent of the government at this point. It's actually was something that was being, I think, initiated years ago that's just coming to fruition now. And I can't speak to this as well as Dr. Daskalakis can. He's been part of this effort. But that's really something I wanted to discuss with him is if you don't know where to turn to figure out what to recommend, what's the best website, what's the best organization you can go to, because, saying right now there's recommendations from the government to discuss with your physician. Like, this vaccine is not necessarily recommended anymore. Discuss it with your physician. Now it's on us. It's on us to figure out what to say. And so there are resources available, and I know Dr. Daskalakis is gonna talk about that. And it varies, right? It varies. Like you talked about my patient population, cystic fibrosis. This is a population with bronchiectasis, and I have been pushing the RSV vaccine as hard as I can. Once it was approved for people with lung diseases, who are not in the older population, because we absolutely see people ending up in the hospital. Strangely, and nobody understands this one, people with CF, despite having bronchiectasis and a lot with diabetes, don't seem to be susceptible to severe COVID, which is so bizarre. And nobody understands that. And so obviously I push, I say you should get the COVID vaccine, but that's not what I'm going to argue about as much. But that for me is helpful because I know the science for my disease, right? So, there's the guidelines about the vaccines specifically and which populations they've been approved for. And then, I think as individuals who have, specific patient populations, then we need to either turn to our, the niche organizations, whether it's ILD or pulmonary hypertension or, cystic fibrosis. And that's where you have to be able to dig into the science because it may vary with each population.
Absolutely. And you, from a pulmonary lens, is there a question in your mind that you would love for Dr. Daskalakis to answer about where the science is actually heading with regards to, you mentioned the RSV vaccine, which is another revolution or progress that we've made on the vaccine front. Any questions that you would like for him to answer about where the science is actually heading versus where the politics is pulling?
Yeah, I mean, he has such expertise going broadly with so many diseases and vaccines. And, there's new the new science, the new, modalities, whether it's mRNA vaccines or other vaccines, in terms of, talking about, I wanted to ask him, what are some of the most misunderstood things about the novel technologies? Things people say how fast the vaccine was approved. Well, was it really that fast? And were there shortcuts taken, or was this done in a way that was absolutely rigorous? And because we're going to continue to have new modalities and wonderful new technologies to help with vaccination, kind of mixing together the science and the politics a little bit, he can speak to other countries that have done this really well. What other, as you pointed out, that vaccines affect the entire world. These are important for everybody. And we're not the only country who's been trying to figure out how to do this. And so he can speak to other countries that have done well and done probably maybe better than we have in the United States at messaging and rolling out campaigns to help with vaccines. So there's a lot of learning to do, and I'm really excited for him to share that with us.
Thank you. And we've just heard two very different previews, one about vaccines, one about the Supreme Court. But if you're listening closely, they're really the same conversation. They're both about what happens when the systems we trusted to protect patients start shifting underneath us. And I think that's why ATS chose these two keynotes back to back, because whether it's the science of immunization or the legal architecture that funds our research and governs our practice, these aren't abstract problems. They show up in our ICU, they show up in our clinic, they show up the next time a patient asks you a question and you're not sure the guidance you're pulling up is the guidance you can trust. I think the thing here is, and I think both Katie and Josh would agree with me on this, the answer is not to disengage. It's actually the opposite. It's to show up for these keynotes at ATS, show up with questions, show up with your institutions and your communities, knowing that right now, the people closest to the patient might be the most important line of defense we have. Dr. Daskalakis walked away from the CDC because he believed he could do more from the outside. And Dr. Fessel and his experience at NIH, you believe the repair work starts now. And Professor Vladeck has been sounding the alarm about how quietly power shifts when no one's paying attention. So my proposal is that we need to start paying attention. That's the ask. We need to go to these talks and don't just sit there. Bring the questions and Katie and Josh raised today and push those even further. That's it for our episode of ATS Breathe Easy. We'll see you in Orlando. And again, I've been tremendously honored to have this conversation. I'm looking forward to both of these keynotes. And it was a pleasure to talk to you both.
Thank you so much.
Thanks so much. See you in Florida.
All right. See you in Orlando.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.